Did you just have a baby? And are you having pain with intercourse and intimate relations with your partner? Well, here are 2 ways that can help. Number 1, using dilators. So there are a number of reasons why you might be having pain during intercourse, and it could be from tight tissue. It could be, something that happened during labor and delivery. There could be injury to the tissues. You could have scar tissue. You can have an irritated nerve. You could have muscle spasms or trigger points in the muscles because you had such a rough time during labor and delivery. But there are these tools called dilators, and these can help with stretching the tissue. These can help with working on muscle spasms to relax the muscle, or trigger points to try to release that hyperactivity in the muscle. There are ways to even work on the tissue, like massage the tissue around a nerve that might be irritated along the vaginal canal. So some are called dilators, and they look like this. And then some tools that you can use are called pelvic wands, and they look like this. So they have a curve, the pelvic wands, and sometimes it just gives you a little bit better mechanical leverage because you can hold it easier than something straight. But these are ways to get deep in the pelvis and reach areas that otherwise you can't reach, right? You can't get to those areas that are deep, and are deep in the hips and the pelvis, and get the tissue to release. So work with the pelvic floor physical therapist to learn how, in particular, to use them with different strategies you can use and techniques to work on your tissue at home, because you can't be seeing the pelvic floor physical therapist every day. You have to work on it at home, but you can use these tools. So that's something that might help. Number 2, another way to help if you're having pain with intercourse is doing stretches. Stretches for the pelvic floor, stretches for the hips to help open up the hips. When you were pregnant, you were very limited with your range of motion and what you can do with your hips and your pelvis. So we want to stretch and open up the hips and the pelvis. And we want to stretch the muscles that maybe took a beating during labor and delivery. So a really great stretch that I like to show my patients is the happy baby pose. It's a yoga pose. It looks like this. And also the pigeon pose, which helps open up the pelvis and the hips again. And so these are great. They could be a little intimidating. Maybe you can't get into them right away, but there are modifications that you can do. And holding them for at least 30 seconds minimum, and the longer the better. So again, these are stretches that help open up the pelvis. Reach out to a pelvic floor physical therapist that could help you with a good program to help stabilize your muscles again, to help heal your pelvic floor, and to just get back to being intimate with your partner and having fun doing that. So follow for more.